Before I say too much, in welcome you all, I want to acknowledge and pay respect to the Wurundjeri people of the Kulin Nation on whose traditional land we meet today. We are honoured to be on the ancestral lands of our First Nations, the custodians of the earth and of all things that grow and breed in the soil. We thank them for passing their wisdom and heritage to every people since the Dreamtime. We acknowledge the wrongs done to them by newcomers to this land, and we seek to be partners with them in righting these wrongs and in living together in peace and harmony with them and with the land, our common home. We look forward to the day when Australia will formally recognise them, listen carefully to their voices, acknowledge their wisdom, and extend to them the justice so long overdue. Well, we have a busy program for this evening. Welcome everyone, of course, who is here in person, present in person, and we welcome as well all those who have joined us online. This is quite a special event. It's the first time since we've got going, admittedly during the COVID period, or just before the COVID period. It's the first time that the people in person attending have outnumbered the people online. Usually it's 2 to 1 the other way. Okay. Well, we're going, of course, in a moment to hear from Professor McGorry. After that, you all have on your tables a program that you can look at if you wish to. After that, we'll have the first Q&A, let's say 15 to 20 minutes. Then we will, in our respective tables, have a bit of a conversation around some key issues. We'll then, at which I hope you will have formulated each table, but I'll say more about that later, some questions that are worth considering, some of which Professor McGorry might want to respond to. And in between some of all these aspects of the evening's program, I will make a few announcements about things that might be coming up. Well, the first thing I want to do is, of course, to introduce Professor McGorry. He's the Executive Director of the Orygen Institute, a psychiatrist known worldwide for his development and scaling up of early intervention and youth mental health services and mental health innovation, advocacy and reform. He's Professor of Youth Mental Health at the University of Melbourne, founding editor of the journal Early Intervention in Psychiatry. He led the advocacy which resulted in the establishment of the by the Australian government of the 2005 National Commission, Youth Mental Health Commission. He's also played a very important role in advocacy when it comes to government, not just in Australia and in Victoria, but in many parts of the world. He was the Australian of the Year in 2010. It's a pleasure and a privilege to invite Professor McGorry to address us.
Oh, well, thank you very much, Professor Camilleri, and good evening, everyone. And thank you very much for the invitation to be here tonight. It's great that it's going to be interactive. And so I guess what I'd like to do is just give you a bit of a landscape of mental health, what's happening. I think the title of this series, Crossroads, is very appropriate actually for mental health, because we really are at a crossroads, especially in Victoria with this Royal Commission that obviously was involved with it in the development of, but now we're at the crossroads as to whether it's going to get implemented properly or not. But I guess, my focus is on young people, and I hope to show you that the greatest concern in terms of the whole landscape of mental health is around young people. And I'll show you some facts and figures and some of them be a bit depressing, but I'm trying to also show you some of the solutions that we might be able to sort of work on together, and be great to hear what your thoughts are, and we can discuss that later. So, don't think the mouse works, does it? So could I get I'll have to ask for the slide to be moved. So this came out yesterday, this piece in the Medical Journal of Australia, co-authored with a couple of other colleagues. And it's basically focused on what is now a public health crisis in youth mental health. Next, thanks. I have to turn around and look. That's just the companion article. So keep going. Yeah. And so these are the questions. Because I can't read the screen, I'm sorry. I might take that out actually. Turn around. So the first question is, why is the mental health of young people declining so steadily and sharply over the last 15, 20 years? And obviously, we've all come out of the pandemic. That had a very significant worsening effect in over a very short period of time on the mental health of teenagers and young adults. We don't know about children because there's not much data on younger children. And I think there's also data that we can't show you showing that everyone's mental health is affected by the pandemic across the world. So how do we, another question is, how do we work out who's at risk or who's in the process of developing a mental illness? How do we tell the difference between that and just, life, the human condition and all of that? What treatments, what interventions do we have at each stage of this? That's something that's been a very important part of our research down the road here at Orygen. And what systems, what models of care are going to work, which obviously not all clinicians talk about, because as the Premier said, in Victoria we had a broken system of mental health care. And it's still broken, still broken, that is what all clinicians have. So, next, thanks. Okay, so I'll start by showing you some data. Next. So this is the burden of the disease. This is a concept developed by the World Bank and WHO about maybe 30 years ago nearly. And you can see that this is the incidence curve. So new cases of illness across the lifespan. Sorry, I was saying the wrong thing. And you can see that in little kids, there's a fair bit of physical illness, not much mental illness actually in little kids, things like ADHD maybe, and autism and stuff like that. But mental illness, as we know it in adult life, really kicks off around puberty and starts surging through adolescence, peaking in the early 20s. And then the new cases drop off a bit. But these cases, if they don't get better, accumulate across decades of adult life. And then in older people like us, well, not everyone in the room, but you see that the physical illnesses start to kick in again in a big way. So over 50s, it's mostly physical illness. Naturally, mental health gets better as you get older, except in the context of I suppose, isolation and physical illness and things like that. So that's the pattern. And yet our health services are designed as if it didn't exist. They designed as if it was just physical illness, so little kids and older people. There's nothing much for these people. The health services, because they're physically healthy, we did not have a strong mental health system around teenagers and young adults until recently. And that's starting to improve. Next, thanks. So this is the US Surgeon General, Dr. Vivek Murthy, who spoke at the end of 2021 about the youth mental health crisis. I'll just show you some of the things he said. If I could get the next one, please. And this is an interview with the New York Times, and he actually recognized many of the things that young people have to face. And emphasize that today's generation of young people are facing unprecedented and uniquely hard to navigate challenges. Now, you might think that's a bit of a joke for people who lived through the Depression or the Second World War and stuff like that, but actually, differentially, the young people these days are facing a lot of much more difficult problems than were happening, say, 20, 30, 40 years ago. And he says the effect that these have had on their mental health, including the pandemic, not just the pandemic, are devastating. And I'll show you the data for that in a minute. Next. This is UK data, it just very recently, and it shows two cohorts, one 10 years earlier than the second one, and shows a significant decline in mental health across those cohorts in the UK. Next. And this is from The Economist, suicide rates in 17 different countries. And you can see that they're going up in young people across the world, not just in rich countries. But the most dramatic rise has been young women. Now, there's still 4 to 1 young men versus young women who die from suicide in this stage of life. But the trend is worrying about young women. Next. This is a thing that's called the mental state of the world. It's a bunch of global health experts involved in this. The next, thanks. And this shows mental health scores across different age groups. And you can see again, in all parts of the world, the mental health of younger people, 18 to 24, this is young emerging adults, is worse than in older age groups. So, and that's a pattern across the world. It might be a little bit different from continent to continent, but that's a pretty robust sort of feature. Next. And in Australia, we have, intermittently, we have these national mental health surveys, which are done very rigorously by the Australian Bureau of Statistics with interview-based methodology. So it's not just based on help seeking or self-report. They go out into the community in a sort of carefully designed study to sample the population properly, and they interview a bunch of people across the whole lifespan. And what they showed was that in 2007, 26% of 16 to 24-year-olds were diagnosed with a mental disorder in any given year. So that's a quarter of young people back in 2007. By 2021, it had risen to 39% of that age group, which is 2 out of 5 young people. Now, it doesn't mean they all have got serious mental illnesses, but it does mean they have some type of need for care. And maybe a half or so, maybe a bit more, would be more severe and need longer term sort of care, but it's going up. That's a 50% rise in prevalence in a 15-year period, which if that was happening with if cancer went up by 50% in any age group in a period, there'd be mass panic, there'd be huge investments, there'd be dramatic health policy changes, but that data which appeared last year has sunk without trace. Absolutely no response yet from that. Next, thanks. And this is the Hilda survey. You probably have heard of the Hilda survey, this household survey of Australian households done every year. I think it's every year, yes. So going back 20 years, you see a steady decline in the youngest age group, the 15 to 24 again. And you can see the effect of the pandemic at the end here. You can see the pandemic had a really catastrophic effect on that age group for lots of social reasons, social and economic reasons. They're vulnerable, they're precarious in life. That's probably a good way of putting it. They're in casual employment, they're studying, they're trying to become independent, and pandemic just put a complete, lid on all of that and caused lots of effects, cohort effects, which probably happened in younger children as well, with the school closures and things like that. We're seeing much higher rates of school refusal now in younger children as well. So next, thank you. So this is the depressing part of the talk, by the way. So this is the pandemic data, and again, you can see the whole of the lifespan. This is an Australian study, but it used worldwide data published in 2020. And you can see that the orange bit at the top, that's the excess amount of mental ill health, mostly anxiety, depression, that sort of broader spectrum sort of stuff. And you can see that it was worse in the younger age group again than the older, and particularly in the females, particularly in females again. So that seems to be another feature. Next, thanks. UK data showing the pandemic effect of help seeking for child and youth services in the UK, big surge, and treatment delay, of course, as well. Next. eating disorders data. And this is Danish data showing the same thing of rise over time. This is over, I think, since 2010, going up in males and even more in females. And it's the biggest rise again in the lifestyle. So this is not just happening in Australia, it's happening in most countries where we have data. And we don't have data in more countries. Next, thanks. So the big question is, why is this happening? And of course, a lot of people have theories about that. You probably can read it in the newspapers as to what the main theories might be. Social media is probably top of most people's list, but you know, what's the evidence for that? There's an author called Jean Twenge who sort of parallels the rise in these problems from the advent of the smartphone. So there's associations here, but whether that's the full explanation, it's hard to prove these things actually. It's really hard. Next. But they're called megatrends. And I suppose the biggest megatrend of all has been around forever, which is the kind of attitude that society has towards young people. And I mean, in a way, we glorify youth, but we punish it. You know, I mean, these are some of the quotes. You can go back to Socrates if you like, or Shakespeare, but more recently, young people in Australia, the pessimism that's coming through in their sort of view of the world, and also in their parents' view of their future. And you've got, you know, Professor Duffy from the King's in London, the Professor of Public Policy, describing Gen Z in his book Generations. They're destined to be the worst regarded generation ever. And this pattern is nothing but a reflection of our timeless denigration of young people. A UK psychiatrist, John Gunn, said many years ago that it's a puzzle to him. He was a forensic psychiatrist in the UK, and he just spoke about how it's a period of turmoil in their life and a lot of difficulties, a lot of challenging issues arise at that time, but people turn away from them and they blame the young people for the problems that they're suffering from. And he described it as this neglect as a special form of self-harm undertaken by adults to society. So that's a bit of context. Next. And so they end up feeling, you know, the future is not very positive. And that's a really strong theme. Next. This is a paper that appeared in one of the top psychiatry journals, JAMA Psychiatry, maybe about a month ago. And it makes the point that a number of people have made that we're treating more and more, we're turning away actually more and more people from treatment. But this wave of need, what's causing it? There's something wrong with society. There's something gone wrong, you know. And even in recent years, something significant has changed. A bit of a sea change in society that causes this surge in prevalence. Next. So just a couple of points from the article, and it reminded me of Michael Marmot, the famous British social scientist who is giving British governments a pretty hard time right now. And he says things like, what's the point of treating people and returning them to the circumstances that made them sick? And obviously you've got to treat people if they're sick, but you've got to do something about the conditions in which it's actually being caused. And so that's the whole thing about social determinants, but also cohort effects, like the global financial crisis was one, and obviously the pandemic was another one, which these are body blows to emerging generations. Okay, so I won't go through all the rest of it, but because there are other issues that affect this point. Next, thanks. And this is probably a worrying one. This came from that Mental Health State of the World report. And I don't know how valid the data actually is, because it's not well referenced. So take it with a grain of salt if you like. But if this is true, that stable and loving childhood homes are no longer the norm, and this is not blaming parents, it would be blaming the levels of advantage in the society, like what's happening in the UK at the moment post-Brexit. You know, it's not possible. The security around, the scaffolding around emerging adults is not strong, and maybe getting weaker. Next. Climate change is another thing that young people will say is affecting their mental health, if not the risk for mental illness. They've definitely got a lot more anxiety and pessimism about the future coming from this source. Many young people. Next. And then this issue of inequality, which would be great for you to discuss. These are two books written by British epidemiologists, one more generally about the effects of rising inequality on a whole range of social measures and economic measures, like, for example, teenage pregnancy and things like that, domestic violence. All of these things are affected by inequality in society. And societies that are more equal, like Japan or Norway, have lower levels of these things. We're somewhere in the middle, but heading south. And the inner level, that's more about the effects on mental health. Next. And then there's this great book written by an Australian author, Alison Pennington, which says Gen F, which is basically Gen X. So Gen Z is Gen F, pretty much. So it talks about things like insecure work, how work has become insecure. Many of these things are the consequences of neoliberalism, 30 or 40 years of neoliberalism in society. Starting with Thatcher and Reagan in the 80s and just spreading around the world, privatisation, undermining the public sector, undermining the government, all those sort of things. That's what she's chronicling in here. And it's led to intergenerational inequality as well, with wealth transfer from young people to old people, which Shorten tried to fix in the 2019 election, but punished for it. So things like that. She talks about social media, climate threat, and then the cohort effects I mentioned. But the general thing is a loss of security around young people. When I went to a workshop at the University of Greenwich a few weeks ago with progressive economists who were having a big seminar on these issues, and they actually presented some frightening data about what's happening in the UK about the level or the rate at which inequality is increasing. So the amount of inequality that increases each year is something like a quarter of GDP, is being taken out of the economy in that way and transferred to elites, basically. So you're starting to see in Australia, just even in the last few days, a few social policy ideas that are starting to challenge this, like Tony Burke yesterday, trying to reverse some of the casualisation of the workforce. That's one thing. And I think even Jim Chalmers' Wellbeing budget is starting to get a lot on track with some of these things. So there are some green shoots for the recovery from neoliberalism that I think is sort of what we're seeing. You can see how, even though we're talking about mental health, you soon get into the political and the economic realm. It's really thinking about prevention. Next thing. So then there's the two great books, both called Generations, one by an English guy and another by an American woman. The first one's more about, I would say, commonalities across generations, and a bit more sort of hopeful in some ways. The second one really pointing out the distinctions between the different generations and showing how, in a way, what the differences are. There are quite significant differences actually between some of the different challenges or conditions around them, but also the way they think. And I think this last slide in this section is about Generations Z. Yeah, so this is taken from Jean Tweng's book. So these are some of the things that are, they're generalizations, right? So they're trends rather than every Gen Z person thinks like this. So there's more gender fluidity, which we're definitely seeing, in the young people we treat. There's a lot more non-binary, a lot more trans young people coming into our services. And obviously they have higher risks because of the issues they have to deal with for mental health. But we're seeing a lot more of that. We're seeing more LGBT prevalence, I suppose, but maybe some more tolerant sort of situation that's more visible, perhaps. Delayed adulthood and sort of growing up slowly. So it's young people are taking their time to reach mature adulthood, partly because of socioeconomic reasons, partly because of better fertility control and things like that. It's a lot of the milestones for achieving mature adulthood in terms of social and economic milestones, they're getting delayed. There's a greater interest in in feeling safe, and that's probably a reflection of that feeling of insecurity in some ways. But it's been criticised by more right-wing thinkers like Jonathan Haidt, who wrote a book called The Coddling of the American Mind, which is basically saying everyone's becoming soft, paraphrasing, the snowflake theory. It's contested, some of this stuff, actually. Positives are more racial consciousness, but again, this pessimism that comes is stacked against me. Physical health is getting worse, interestingly, in young people. And a positive thing is they're finally becoming activists again. I remember in the 1960s where we were all in moratoriums and stuff like that. You probably do too. And then for a few generations that went missing, but now it's coming back, which is, I think, it seems to be quite a positive trend. She talked about that too. So next, thanks. So that's the landscape now, and that's probably the really disturbing and challenging stuff. Those facts. Now, some people can contest this. That they say, it's a bit of a mirage. People are just reporting it more, or we're creating the problem by talking about it more. It's like, if you talk about suicide, you're going to make it more likely to happen, not. But that's sort of there is some contesting of some of the things I've been saying by some people. But I think the facts are pretty robust if you put them all together like that. So what are we doing about it? Well, probably 25 years or more ago, we started to build a field of youth mental health. It started off with early intervention programs in more serious mental illness like psychosis, which we started about 30 years ago. But we realized that all of these emerging mental disorders in adult life began in this age group, and also there was a cultural thing, and a developmental thing about the type of service we should provide. So we broadened the focus into a youth mental health paradigm. But it is about shifting paradigms, because mental health, when I got into it 40 odd years ago, was incredibly pessimistic. We trained in the old mental hospitals, and anyone who entered mental health care with a new presentation, particularly if it was a psychotic one, like schizophrenia or something like that, they were basically given a psychological death sentence. So they were told they would never recover. The pessimism that psychiatrists had toward these illnesses was just incredibly disruptive to recovery. So we tried to change that, and began with schizophrenia and psychosis, and then extending that to all these other forms of mental health. So this field, could we have the next one, please? Powerful idea, a bit like the Royal Flying Doctor Service. But there are lots of ideas.
Sorry, either they or here, but you can't move back and forth.
Okay, all right. Yeah, thanks. So the Royal Flying Doctor Service, great idea, still going, still flourishing, but lots of ideas are proposed and never get implemented. So they might be the right idea, but unless you can implement it, and that requires, I suppose, a whole lot of early adopters and pioneers and people working together across the world to change the paradigm. And that's what's happened up to a point. Next, thanks. So it requires tools and platforms like this is a journal that was mentioned by Joe at the beginning, a way of sort of stimulating and scientific and other types of efforts in this space. Next. And concepts like clinical staging. Now, this is something that you're probably all familiar with in general health care, particularly in cancer, where the treatment, if the priority is to get the illness at the earliest possible stage to stop it progressing. Now, not all mental illnesses progress, but there's a risk, there's a very strong risk of it progressing and becoming chronic. So what you want to do then is basically, I've got to stop talking now. No, it's okay. Thought my time was up. So the basic idea of staging is that you try to get the illness at the earliest possible stage, and also the treatment is not the same at each stage. So if you present with breast cancer and it's already spread throughout the body, the treatment is very different from what it would be with a very small breast lump that hasn't spread. So the treatment's safer and more effective if you use it earlier, or if you intervene earlier. And then obviously you take more risks to get the person better if the illness has progressed. And that's the same with mental illness as well. same principle. Unfortunately, that because the system's been so broken, it usually provides late intervention, and the treatment doesn't work as well. So that's the reason we developed this idea with my colleague Ian in Sydney. We've been working on that for 15 years and trying to link other research to that staging idea. Next, thanks. And international platforms. We just had the 14th meeting of this early intervention movement in Lausanne last week. And this is a movement across the world, including some low and middle income countries. Now, 43 countries were involved in this meeting. So it's becoming a paradigm shift. And it's also linked strongly to the youth mental health idea because of what I showed you earlier. These illnesses begin in young people. Next, thanks. And so it's morphed from early psychosis services into youth mental health services. Next, thanks. And we set up another network called the International Association of Youth Mental Health. And this had a meeting, it's had 6 meetings. The last one was last October in Copenhagen. And this one is actually co-convened by young people. And every session in the conference is co-chaired by young people. And about a third of the attendees in the age group that we're talking about. So it's a very dynamic meeting. It's fantastic. Very different from the usual scientific sort of meetings. And it's very diverse, very energized and full of power, really. Next. So these are the things that are happening to galvanize and mobilize support for something to be done. We're finishing off a Lancet Psychiatry Commission on Youth Mental Health, which is capturing all the worldwide experience and evidence about this and publishing it in the Lancet. Next. Okay, so on the ground, let's talk about some of the, I haven't got time to go into all the detail, I'll give you a bit of a sense of it. New models of care, because the old models were not fit for purpose. That's why we had a Royal Commission, basically. Next. So we have to build the piece in between child-focused services, pediatric services, and older adult services. That's been the missing piece. Next. And so that began Orygen, where I work. We realized we're only treating about a fraction of the young people in our catchment area of the Northwest who needed help. We needed a high volume primary care system of care that would absorb a lot more and engage a lot more of the younger people at an earlier stage. So it had to be a primary care model, but standard general practice wasn't working for young people. They didn't necessarily see the GP as the place to go, and the GP wasn't well equipped or supported to meet their needs. So that's where Headspace came from. It's meant to, it has GPs involved, but it has other things too, and it's co-designed with young people, meant to be youth-friendly, local, and so on. So that started in 2006, and it's now, end of this year, it'll be 164 centres across Australia. Problem with Headspace is, because of the Medicare crisis, the fact that bulk billing has gone south so rapidly in the last few years, we've lost about 50% of the MBS providers over the last few years at the very time when we need to double our efforts. And so it's in trouble from that point of view in terms of meeting the need and needs a rethink and a reinvention, anyway, refinancing. But it's still an achievement nationally that we've got it in so many different parts of Australia. So there's still some places that don't have these services, but all they are really, if you're thinking about we're building a house, if we're building a proper mental health service for young people, we're building that house where we built the front room, maybe the entrance hall, but we haven't built the other rooms in the house yet. The next level is not there. So that leads to something called the missing middle. So people can get in, but they can't. It's like treating cancer. You treat stage 2 cancer with stage 1 levels of treatment. That's what we're doing. Okay. And I can't show you the whole world experience, but there are about 12 countries around the world who have made these sort of reforms inspired by what Australia has done first. So that we should be proud as Australians that we've actually pioneered this. And other countries are now doing it. So in Canada, there's been tremendous growth of these services in the last few years. And I'd say in about another 10 or 11 countries, including countries like Denmark, the Netherlands, Ireland, places like that. Interestingly, not much in the US or the UK, backward countries. Okay. So this article just summarizes all that progress. It was published last year. in World Psychiatry, which is the top-ranked journal in our field. So we're getting good impact and influence, at least, about these things. Next. And we worked with the World Economic Forum just before the pandemic. The World Economic Forum decided to make mental health a bit more of an issue because of all the non-communicable diseases, including cancer, mental health has the greatest economic impact. You lose 35% of GDP because of mental illness. You only lose 18% of the GDP through cancer, but we spend about 4 times as much money on cancer as we do on mental illness. So they started to think, well, this is not quite right. And so they began a process, and we partnered with them to develop a global framework for youth mental health, including in low and middle income countries where, in fact, 80% of the world's young people live in those countries. Next, thanks. And here in Victoria, I've mentioned the Royal Commission a few times. We managed to have a breakthrough in terms of system design. We managed to persuade the Victorian government, or the Royal Commission and now the government, to actually restructure the child and adolescent system into 2 zones. So we have a 0 to 11 system for younger children up to the end of primary school, and we'll have a system that goes from 12 to 25 years in the specialist side funded by the state governments, and that will mesh much more effectively with Headspace, which is already 12 to 25. So we're covering the right age band now, at least in terms of the design of the system, and that will be rolled out now over the next few years. And it's the only place in the world where that is the case. Most parts of the world, we've still got a 0 to 18 pediatric thing, and then an 18 to 65 adult thing, which clearly does not work for the young people. Okay, next. Yeah, I'll skip that one. It's just the design of those systems. So here at Orygen, here in the northwest of Melbourne, and this will probably be similar in other parts of the state over the next few years, we have 5 Headspace centres, and then we have the state services. We run both of those, or soon we'll run both of those under the one roof, from Parkville, just down the road. It's also a medical research institute, Orygen. I'll show you some stuff about that in a minute. But so we treat about 4,000 or 5,000 young people a year through the Headspaces, and about 1,000 through the specialist program. But it's still thousands of young people that can't actually get access to those services still. And the state government, through the levy, is going to expand the state system over the next few years, as long as we can find workforce to do so. But it's still, that growth is very much needed, and we're very much in catch-up mode. Next. This is what it's going to look like. The main point of the slide is the engagement, the welcoming and the engagement and the friendship bench sort of idea at the front end, so young people can feel comfortable and safe seeking help in lots of different ways, and then they can be sort of offered the right level of care for the sort of problem they're coming with. We don't over-treat, we don't over-medicalize or over-pathologize, but we don't under-treat either. We aim to get people to the right level of care for as long as they need it, as long as we've got enough resources to do it. That's the aspiration. Next.
How are you going?
You're nearly finished. Sorry, Joe. That's the problem. So you might have noticed, if you've been to any mental health service lately, that pretty much nothing has changed since the Royal Commission. So the Royal Commission is really struggling to implement the findings, which was full of goodwill, full 100% support from the Premier and the Treasurer, and from everyone involved. But it's not being implemented properly. It's too slow, and part of the problem is the pandemic and the workforce, and so it's not totally fair to the bureaucrats to say that it's their fault. But we've got to have another crack at the implementation. Next. Yeah, I might just show a couple of slides from this and stop. But the reason these reforms have worked to the extent that they have around youth mental health is because we've combined, absolute clinical expertise with, a desire for novelty, for innovation, and for research, and being committed to making sure we study what we do. And if it doesn't work, we don't do it. And if it does work, we try to develop and expand it. And we've got lots of examples of those things, which I could give you later. Next, thanks. So this is our base. It looks nice, doesn't it? just in the park over here. For 25 years, we're operating out of Zimbabwean types of facilities until they demolish them and replace them. But now we've got first world facilities, which is great, shows a lot of respect for the young people, shows respect for our staff and the field for the first time. Next. So these are the things that are under the roof of Orygen, including training and education and policy and advocacy, and also now digital mental health is a growing feature of mental health care. Next. Keep going. This is some of the. This is worth mentioning. This is the biggest study that's ever been funded by the National Institute of Health in Washington, and they do these accelerating medicine partnership things in different areas of health, and the fourth one of these was decided to be in mental health, and it was focused on schizophrenia, and we are co-leading this study from here in Australia. So first time that's happened. Is the biggest grant that's ever come to Australia for medical research, and it's come to mental health. So it shows that Australian quality in mental health research is right up there with anyone else. So we can do this. Victoria is the place to do it, but it's focused on developing new treatments, which is something that we haven't had for a long time in this area. Next. Yeah, keep going. This is a meeting in New York about that study a couple of weeks ago. Okay, keep going. And the other good news is that the Wellcome Trust in London, apart from NIH, NHMRC and the Medical Research Future Fund discriminate against mental health research. We only get 7% of the budget of the NHMRC and 4% of the MRFF. And we're 15% of the burden of disease. But the NIMH in Washington, we're getting money from them now. And Wellcome Trust, $16 billion is being spent by Wellcome over the next few years in research. 3 areas: climate, health, infectious disease, and mental health. So the first funding agency of any significance to prioritize mental health. Next. I think it's the last one. So to wrap up, these are the 4 priorities: prevention and research, for all these reasons I've been talking about, the early intervention, primary care stuff also mentioned, and then implementation of these more specialized models, which are really in very short supply. And then the final thing I haven't talked about is the NDIS. Only 3% of NDIS participants are in this age group, and yet this is the major pathway to disability in mental health, which in turn is the biggest cause of disability in Australia. But the NDIS pretty much locks us out from support. So there's got to be reform around that in this review of the NDIS. So I think that's the last one. Yeah, thanks very much. Sorry about over.
Well, thank you very much for informative, energetic, and illuminating presentation. Microphone. I better sit down.
Thanks.
So we're going to have a little bit of time for Q&A before we get into some in-depth conversation for a little while in our respective tables. Before I ask for questions from either here, from the floor, or from the online people, let me begin by asking just one question. You spoke, of course, as one of your initial items, prevention. What can be done by way of, if not preventing, at least reversing the trend of towards increasing incidence of mental health, especially among young people? Yeah. Is there something that can lower it over time?
Yeah, well, I think to answer that, Joe, maybe prevention was always an issue, even that we should have focused on even before this rising prevalence started to take off, you know, say 15 years ago. And it's only really been understood in the last maybe even 2 or 3 years how serious that decline has actually been. But putting that aside, even before that, prevention is always an important thing in any sort of major health condition, to try to prevent it rather than cure it. Prevention is better than cure, right? But the risk factors for mental illness have been known, the original ones, for quite a long time. Things like well, this is a genetic risk, which you can't do that much about probably, but then on top of that, the environmental risks have been understood, like disadvantage, child sexual abuse, bullying, things like that. There are definitely things that can be already targeted and have been, people have attempted to do that. Some of them are pretty stubborn things to kind of get rid of, like bullying. Every school's got a bullying policy, but every school still has bullying going on, doesn't it? So some of these things are very hard to shift, even though they're very potent risk factors for onset of mental health. But I suppose what I focused on mostly tonight is these big mega trends. So, and I don't think we can be totally clear which of those mega trends are important and which ones are associated with COVID and social media. So we've got to actually pretty quickly understand which ones are the ones that could be malleable. And if you did, like you say, if you intervened in a policy sense, it would make a difference. And maybe you've just got to have the best bet and do it and see what happens. But I would put my money on the things I try to emphasize, these socio-economic shifts in recent times. But all those things are happening to Gen Z right now. They're quite toxic. Climate change, the rental crisis, the housing crisis, casualisation of the workforce, hate fees, these sorts of things are very cumulatively burdening to young people, I think. And so I think the government's starting to get the hang of that. I don't know how brave they're going to be, but they're starting to at least talk about it, which we haven't heard anything for years about. So I'm a bit hopeful about that.
Okay. So now the question is how we will handle the questions so that people online can hear. I think it would be better if we had a roving microphone, and rather than the person coming to the lectern, going to whoever wants to ask the question. So who would like to, I see one hand there, one there. Now, we've got to have some gender balance in the question. Okay. 2 men is more than enough to begin with, and then we'll try and see whether we can balance it a little. Okay. Victor at the back.
Patrick, brilliant presentation. I'm sorry. That's for that. 6 weeks ago, the Premier described the work cover system as broken. And it's broken because of stress and burnout claims in the public sector. So the system was never designed to have 50% of payouts going to mental health. The stress and burnout epidemic, of course, is not restricted to Australia. Parliament, the Senior Minister in Singapore, has described it as the biggest public policy issue in the world. Do you have a theory, or does anyone else have a theory as to why we have a plague of stress and burnout in the workforce and in Victoria, particularly in the public sector?
It's a great question. Not sure if I can totally answer it, to be honest. But clearly the pandemic seemed to have a pretty significant effect, didn't it? And the whole work culture seemed to change a lot. So it may have been happening like the other trend before the pandemic. I think a lot of employers are trying to get their heads around that and to create more mentally healthy workplaces. I think they're genuinely trying to do that. But they're getting sucked into the wellbeing industry a bit. They think if you have mindfulness classes and yoga mats and stuff like that, that's going to prevent, things like, anxiety and depression. There's not much evidence for that. You might improve mental health. You might feel a better sense of well-being from those things, and that might be a good thing to do, but it's not going to deal with the issue that they're trying to deal with, I think. The other thing is EAPs. They don't seem to work very well. So a better way, we try to get universities to have a better duty of care to their students around student health. Because they pay a bit of service to these things too. So I think that's something that you could help with, but I don't really have a total solution. And it may be related to some things I was talking about, some of the mega trends. Thank you.
Yes, okay. Yeah. Please, everyone make the
I'm a humanist psychotherapist and an existential psychotherapist. They go together. But I'm kind of wondering in terms of the kind of paradigm that you've outlined, how effective it actually is, because I've worked both in the public system and the private sector, and I know, I mean, it's quite well known that in the public sector, the overwhelming reliance is on antipsychotics and neuroleptics, which is pretty heavy drug treatment, which often leaves the patients chemically lobotomized. That's how I would see it. Whether unable to function as human beings like that. So what it does, snowballs the kind of problems that I have. And I'm just wondering, if one looks at the legislation that we have here in Victoria, in most Australian states, you've got things like compulsory treatment orders, which emphasize people undergoing this type of treatment. And I think it's very ineffective.
You have to ask.
I was just wondering,
The preamble is a bit long.
sorry, how much, I only know a little bit about Orygen, but how much actually emphasis is there on counseling, humanistic counseling, which I think is probably the best form of treatment for the kind of things you outline.
Thank you very much. Everything that you said is very much in the spirit of what the Royal Commission goes and wants to change. Yeah, I totally agree with it. And all I can say is that I spent my whole life, originally in early psychosis. I spent probably the first 20 years or even longer of my career. It's still my main thing in terms of clinical work, trying to create a holistic model of care, exactly along the lines of what you said, and making sure that the medications that are used when they're necessary are very carefully used in very low doses, so you don't get those negative side effects. It's possible to do that in most people if it's done properly. And then you need, one of the first things we did when we built EPIC, which was the forerunner of Orygen, was make sure we had a whole range of psychosocial interventions, very much humanistically inspired, as you say, but also evidence-based. So if we had new forms of psychosocial treatment like CBT or with IPS, the vocational recovery programs, they were part of what was offered, family support. So it wasn't just this narrow, crude sort of medical model. It was a much, you don't throw out the medical bit, but you wrap around everything else within it, and that's what we have done. And the services that I described, these reformed, new paradigm types, so that is what people aim to do and mostly do. But the mainstream system, as I say, has not changed very much, despite the Royal Commission, and a lot of patients' experiences are very much along the lines of what you're saying.
Christian, are there any questions online?
I haven't got access at the moment.
Okay.
There are a few Q&A. I can see them pop a few on Q&A, but I haven't got access. So
Okay.
Sorry about that.
Okay. Is there someone else who wants to ask a question? Yes.
Patrick, you talked about the mega trends and how many places around the world are echoing the same thing that's happening here in Australia. But I wondered, are there any places either on a macro level like whole countries or on a micro level like communities we can look at in Australia or in other places that are bucking the trend and that perhaps can show us positive ways?
That's a great question. Well, if you read the Age yesterday, you would have thought Sarnia was the place to be, wouldn't you? Because apparently, according to that survey that the Age did, it was the happiest place in Melbourne. And it's a little bit hard to believe because I've been there. But it's a great, that would be a great thing to do, to try to find counterfactual as to what I've been talking about. I'm not aware of any, because all the data I've looked for the data around the world. I haven't seen, but there are lots of countries that we don't have data from, and it's not possible to get that sort of data. So we should do that. It's a great idea.
Just to mention, for the benefit of our online participants, their questions we will try and post on the website and try and handle in some way, even though we may not be able to deal with them right now. Okay, next question, John.
Thank you, Professor. Thanks, Professor. You mentioned that the present generation is probably the most denigrated generation because of maybe how well or not they're responding to the challenges, the huge challenges they've got. I wonder when you see that changing with the older generation realising the extent of threat that we're facing globally and that there needs to be more intergenerational solidarity.
Yeah. Thank you. That's a great way of putting it. That is the spirit of Bobby Duffy's book, actually, the one I mentioned, the Generations book by the English professor. He basically talks about that point that it may not be helpful to exaggerate the differences between different generations. And definitely we need intergenerational solidarity, because the other thing is that people in our age group are very dependent on the mental health of the younger generation. If they fall on the scrap heap in big numbers, which is what's happening, their capacity to support us, is going to be diminished. But we've done a very poor job of supporting them. There's been wealth transfer. Give us saw that like chronic measured the amount of wealth transfer in the last decade from their age group to our age group, which, whatever your politics, Bill Shorten did try to do something about that, negative gearing and franking credits, and got completely punished for it. So our generation, not the people in the room, of course, but other members of our generation really were very selfish, are quite selfish in many ways. So you're right, we have to get over that somehow and work and be together. And the young people are very forgiving. If you look at the pandemic, they sacrificed their health in many ways to keep people in our age group alive, and that has not been properly acknowledged, I think.
One more question. There was Susan. There was someone at the back.
Hello, that was most of the invitation. Thank you. A few years ago, I went to a talk of yours outside of station community. A few years ago, I went to a talk of yours, and I was part of a collective of young people. And we actually worked on the paper with the Victorian Youth Congress. We worked on the paper with the senior that is now part of your research. It was really amazing to see, and I will let all of my colleagues know. But one of the things you mentioned there was about the really high rates of suicide amongst young men. And you said that if those same trends, which were wartime levels of deaths in certain ways amongst young men, when there is no active war in this space, what's happening now, then it would be a huge crisis. And now you've mentioned that we are having increasingly high risks of suicide amongst young women. I'm curious to know what are the differences between what are driving those. You mentioned a whole list of things, but what are like the key differences between, the mental health impacts that happen to young men as opposed to those that happen to young women? Are they similar? Are they different? And is there any kind of convergence or anything that we need to do to be able to bridge that gap so we don't have what's happening with young men happening with young women?
Yeah, that's a great question. I think the only way to answer that question, though, is what you said at the beginning. We've got to work with young people to understand it from what their experience is, because in some ways you could say that the situation with young women in some ways appears to be getting better, in terms of their a whole range of gender equality and whole things like that. But on the other hand, their mental health seems to be getting worse. There's some other things that the Gen Z, or the book about generations, says about Gen Z too, that they're using drugs and alcohol less. They're having sex less, believe it or not. Can't be much fun being a young person these days. But sorry, I didn't mean to be flippant, but those are interesting things, aren't they? There are other changes like that. So, but it's hard to understand without working really closely with young people, which we do. As you pointed out, like we try to understand these things together. We try to design the services together. And we were about to appoint young people on our board at Orygen for the first time, which is fantastic. And so the youth engagement, youth participation, we can't understand it without without the young people's voice being there. So maybe you can help us.
Thank you. We'll have another little session of questions a little bit later. So thanks, Pat, but you won't go away, will you?
I won't go away.
No. So if you'd like to take your seat there, we'll come back to you in just another 20, 25 minutes. Don't need it. So what we're going to do now is have conversation in our respective tables, as I said, and for that we're going to. I have constructed two questions, very simple. Each table, please, if I could have your attention so that people can concentrate. No whispering for just a minute or two. You'll have your chance to talk as much as you wish in a moment. Most tables should have a facilitator. If you don't, well, you can appoint a facilitator amongst the 5 or 6 of you. Okay, the facilitators, if they haven't already made themselves known to the rest of the table, I'm sure they will soon. Okay, so 2 questions to put to you. And I think Ben, in a moment, will be able to bring them to the screen. The first question follows directly on from what Pat was describing to us, and it poses the question: what issue arising from the talk has most grabbed your attention and you think is worthy of being followed through, not just by specialists and experts, but by engaged members of the community? Ben is still looking, it's nearly there. Next slide. It'll come. And the second question is there a question you would like the gathering as a whole to consider? And maybe 1 or 2 of these questions, we can't do them all. Pat McGorry might be able to add his own thoughts to that question. I have at the back of my mind that many of these questions that are now going to be formulated, including by groups who are going to have their conversation online, will be posted on the website for further discussion and conversation after this evening has concluded. So here are the 2 very simple questions. You're not limited to these questions. We have about 25 minutes for in-depth discussion, and there are 2 things to remember. Listening is at least as important as speaking. Don't allow any one person in your table to dominate the discussion. Just cut that person down to size. Okay? The one who wants to dominate, even if it's done unconsciously. All right? So everyone gets to go around the table, not once, but a couple of times, and maybe more. Okay? So we'll see what you make of these 2 questions, or any other burning issue at the back of your mind. Within reason, we've only got 25 minutes. Okay, over to you. Okay. Okay, if I could have everyone's attention again. I'm sorry. Hello? Hello? All right. Now, please, I know it's a very, very intense set of conversations, but we will be able to continue them informally a little later. And I remind people there'll be more food, sweets, coffee, tea, whatever, after we have finished here, if anyone wants to keep on chatting informally. Before we have our second go at a bit of Q&A, and this time round, we will ask anyone who wants to put a question from our online participants, if they can unmute themselves when they're recognized, and then they can put their question directly. And perhaps we'll go to them first in a moment, and then back here to those who are in person. Before we do, I just want to bring a couple of things to your attention, and that is in what is being planned for the weeks and months ahead, because we always have to have our focus clearly onto the future, not just what has happened so far. Well, our next event in this series will be an important first for Conversation at the Crossroads, because we're going to be holding it in person in Sydney. It's the first time that in person we have held an event outside of Melbourne. Although we have had many, many hundreds attending one or other of our events online, not just from around Australia, but internationally. At the latest count, we've had over 2,000 people participating in at least one of these events, 350 of whom are overseas. And that's growing, which is good. Now, our next event is very much focused on an international issue, but with an Australian focus, and that is, as the flyer on some of on the table suggests, it is going to be focusing on what we've called the Palestinian catastrophe. It's one of the great tragedies of our world today, with repercussions for the rest of the Middle East and well beyond. So we have rightly said that the regional peace in that part of the world and its ramifications globally are going to be of concern, are of concern to us, and we're going to focus on what Australia's response should be, as well as other responsible governments, which may be few in number, but anyhow. And we've invited Bob Carr, who's probably one of the best known political figures in New South Wales, as former foreign minister and the longest serving, continuously serving Premier of New South Wales, to give the keynote address. And here will be followed by two fascinating responses by two young women, each of whom has an outstanding background in issues of human rights. Okay, so now, none of you, unless you're traveling through Sydney at the time, will be able to attend in person, but we warmly welcome you to join us online for that event. And secondly, I have a request. Please take it seriously. Do you know anyone at all in Sydney? Do you know anybody? If so, please let them know. Please let them know with strong encouragement to attend. It should be a fascinating occasion, and it'll be moderated by Professor Stuart Rees, Emeritus Professor at Sydney University. Okay. Now, beyond that, the Voices series comes to an end with that Sydney event. We have a number of other things on the go, and I'll just very quickly mention them in 2 minutes flat. The first, we've had two of these, is Big Ideas in the Pub. Christian, did you want to say anything quickly?
Yes, I can't confirm a venue yet. We are in negotiations with a couple of iconic Melbourne pubs, but the topic and the topic will be truth and propaganda. The date set Thursday, the 17th of August at the usual time of 7 p.m.
Okay, so that's another one to look for, and this is in Melbourne, and it's not available online. You attend in person or you don't attend at all. So in a reasonably central location in a pub. Did you say the 17th of August?
That's
Okay.
Thursday. Yeah.
Politics in the pub, a little bit further down the track, possibly around, I don't know, September, October. Sorry, what is it?
30th of September.
30th of September. Hopefully, sunny weather will be kind to us at that time. Politics in the pub. Is it still artificial intelligence?
Yes.
Yes, and the topic artificial intelligence. And finally, conversations that matter. We've had many groups joining in ongoing conversation on a periodic basis. We are probably going to try and revive the project, though there are still some groups meeting regularly, and see whether we can involve some more people as well as a wider range of topics for discussion. And finally, this is very, very important. We're going to launch within a month to 5 weeks a national survey of the people that have had some connection with us on what you think on a number of issues and a number of possibilities in terms of future activity. So the survey is being prepared as we speak, and you will hear from us probably within 5 to 6 weeks at the most. Please take the 15, 20 minutes it will take to answer the survey, probably a lot less, but no more than that. And it will be an invaluable planning instrument for us in the coming months and beyond. Okay, so now we go to Q&A, and hopefully some questions will have arisen from the conversations that you've had, and Patrick will join us again here. And Ben will probably bring us the microphone so that now, who is able to identify questions from any of our online participants? Because I'm not in a position to do that at this point.
Just asking the main questions that I'm using.
If any of you have a question, would you raise your hand and we'll recognize you? I can't see any hands going up. Anyone has a question? Not at the moment. Oh, yes. Unmute, Karen.
Okay, can I be heard?
Oh, yeah, loud and clear.
Okay, my question is, to what extent has the apparent obsession with mobile phones and the paucity of relationships from that had an impact on the mental health of young people?
Yeah. That is a very good question. The person I mentioned earlier, Professor Jean Twenge from California, her book Generations, which I showed you, she presents a lot of data showing that the worsening of mental health in the US, in young people in the US, really started to take off at the point where Steve Jobs launched the iPhone. So, and she tries to make an argument that it's one of the major contributors to this worsening trend of mental health. Now, how it would have done that? Is it because it's drawn people away from, face-to-face or in-person relationships in some way, or is it cyberbullying, or what are the factors underpinning that might have contributed to the worsening of mental health? But on the other hand, other people make the argument that social media and smartphones have connected people better too. So it's not black and white, I don't think. But definitely the problem with it is it's so unregulated, and it's sort of gamed by the big tech companies. You know, it's deliberately made addictive. All of these things are quite addictive, and they're commercialized. There's a hidden commercial value system sitting behind it. So it's got to be a serious candidate to be investigated much more carefully and regulated a lot more. Although with Elon Musk, you know, he seems to be completely out of control. So I don't know how they're going to do that.
Anyone else from our online? Yes, please go ahead.
Hi, everyone, Professor. So from our group, we spoke a lot about doing more in schools. So our question, I guess, is what can we do to help the schools do better? I guess to build connections so that then it's like more preventative care than actually having to fix it when they become young adults in that sense.
Yeah, great question. Well, schools are obviously a massive potential focus for tackling the problem. And if you talk to any teachers, they're extremely aware of the seriousness of the situation. One of my colleagues who works at La Trobe, she's one of the teachers at La Trobe. She did her PhD on rural and regional schools in Victoria, and it was quite staggering the amount of contact that teachers had with completed suicide in students, you know, and sort of very poor access to care in those parts of Victoria, and the teachers are just abandoned in a way to deal with it. And so there are things like the federal government's got a thing called BU, which is run through Beyond Blue, which is basically an online support system for teachers, but it's pretty weak compared to what's really needed. And the other thing is that the evidence and research of what works in schools in mental health is that these programs that do universal, you know, things to all the students, they sound good, you know, wellbeing programs, and you know, Geelong Grammar having a $30 million wellbeing centre, all that stuff. As I said before, it improves well-being and it improves mental health and confidence and all those sorts of things in a positive way, but it doesn't deal with what we're talking about here, which is a subset of students. And those students' needs are very poorly met by most schools. So it's not in Victoria, the state government put in programs like docs in schools, I think the election before last, and so they are trying to put more professionals into the school environment and link them up with the headspaces, but it's only a minority of schools that's sort of so far been impacted by, and they're government schools, obviously. So I'd say it's very patchy, piecemeal, and not very systematic, and not necessarily based on the evidence. You know, there's a lot of feel-good type things that people think would be good, but they may not work, and they might be missing the point. And then you have the emergence of more serious mental illnesses in a subset of those teenagers. So much so that if you look back on the histories of people who develop serious mental illness, you know, maybe after they leave school, something like 48% of them dropped out of high school. So even if you just screened all the dropouts from high school and helped them to get back into school and get back on the trajectory before they became really seriously ill, that would be another way. So there's lots of, you know, logical things to do, but they're not being systematically done.
Well, what sort of peer support amongst the students? I mean,
Yeah,
the students themselves help each other.
Yeah, that is a fantastic question too. I remember about 10 years ago, I got to tour schools in New South Wales. It was part of the Australian of the Year thing. I got to visit lots of schools, and it was quite amazing that you could feel whether the school was a healthy culture the moment you walked in the front door. You know, you could just feel it, you know. And one of the schools was out in the worst parts of Sydney, Macquarie Fields, where there had been massive riots and all sorts of things happening the year before. But in that school, there was an inspirational deputy principal who had set up an amazing peer support program for the kids. And what they did, they trained about 30 to 40 sort of senior high school kids, like big brothers and sisters. And they were trained in listening skills, mental health first aid and stuff like that. And not just mental health, but any way of helping a peer. And they had a little badge or, you know, ribbon on their blazers, which they wore. And any younger kid or any kid in their year you could approach them for help about anything. So they knew they were, and the kid could choose which one to go to, so there was a choice. And that was amazing. It was never really evaluated or scaled up, but I've talked about that many times to try to get that to be looked at more seriously. And I don't think that's really spread very far, but it was a brilliant sort of idea, and it seemed to work really well.
Great idea. Any questions here? Casey?
No.
Thank you, Joe. Thank you, Professor. Our table recognize that your focus is on health, mental health, and in particular, younger people. There's one area we hope to raise with you is more on the economic sector. And I'll start off with the second question, which is, to what extent is stigmatization a problem throughout the whole spectrum of this issue? And linking on to the extent to which business and economics are involved and brought into the conversation, because we feel that it is a significant stakeholder in this. It involves their labor force and also their market. Thank you.
Right, yeah, two great areas. Maybe deal with the second one first, because it touches on what Victor was saying before about, workforce and I mean, if you think about young people and even the whole workforce as a resource for society, if it's not looked after in a careful way, you're sort of I don't know, whether it's work cover or just lost productivity in a way, and people turn up to work, but they're not really contributing as much as they could. They're not flourishing. There's a sort of a whole loss of productivity. It's not just the dramatic things like ending up on disability or dying of suicide. It means the people that aren't producing it, even if they're underachieving, and if people have persistence, even if they're mild or even not such severe mental illness, if they're chronic, they're just undermining their ability to contribute to society and to develop, to flourish, really. So it's subtle, but if you imagine it adds up over tens of thousands of people, it's a big thing for the economy. And this is why there's a term called mental wealth, which means that the neglect of this subclinical or even fully clinical mental illness across the whole society, it reduces the mental wealth and the social capital of the country. And so that's why it's very, very powerful. And that's why that World Economic Forum study, which showed that 35% of loss of GDP was due to mental illness, that's what it amounts to. And the other big factor is because of the timing and the life cycle. Cancer doesn't impact on the economy that much in that way because it's in older people mostly. Whereas these illnesses, sap the strength of people in the prime of life, So I think your point and Victor's point are very, very important. That the issue of stigma has improved to quite a lot in many ways for the more common mental disorders like anxiety and depression, because most of us can relate to that. Either we've had it ourselves or we know someone who's experienced that. And there's so many people speaking publicly about that these days. We can relate to it, and everyone knows what those normal feelings of anxiety or sadness actually are. They can imagine, how if it gets much worse. Actually, severe depression is much worse than just a lot more sadness. But nevertheless, we can kind of get a sense of what it is, and we're comfortable talking about it. And probably less than before, we're not seeing those people as weak. I mean, there's still a sense that if you get depressed, you just got to pull yourself together, but it's much less severe than it used to be, that thing. And Beyond Blue deserves a lot of credit for that. They've done a good job in normalizing and the understanding of that. But then when it comes to anorexia or borderline personality or schizophrenia or bipolar, or especially drug and alcohol use problems, addictions, they're very judgmental and stigmatized still, aren't they? And people still either don't understand them or judge, you know, and like, you know, you see the footballers. If this footballer comes out and says they're depressed, lots of sympathy, lots of support, you know. But if they take drugs to self-medicate, or if they drink too much and you know, get a bit aggressive or something, then massive judgment, you know, yeah, made the wrong choices, you know, all that sort of stuff, you know. So it's really a long way to go all the same, but it's probably headed in the right direction.
Any other? Susan, have you spotted someone? Yes.
My question is based on rules, laws, and regulations, and too much freedom, I'll say. So you're looking at your generation and comparing that to University of generation. Your generation and generation, we tend to learn from that hold certain principles that we will not take. So comparing the both generation, would you say that in our generation there is a lack of rules and regulations and too much freedom compared to your generation, and could that significantly impact our
That is a very insightful question. I've thought about it in a very similar way, not exactly the same way about rules and regulations, but more like when I was growing up, there were very simple pathways to adult life, you know. Either you left school and you got an apprenticeship, or you got a job, or you went to university, and the choices weren't, you know, that wide ranging. When you went to university, you had a few choices, and they were very gender based as well. Women were channeled into certain routes and men the other way, and so it was kind of narrow choices, I suppose. And so I think you're right. There's a lot more freedom in some ways these days, but then you could almost say it's partly the price of freedom, you know, the mental health, the insecurity of too much. I wouldn't say too much freedom, but more freedom, combined with a lot more of the economic sort of burdens that we've inflicted on them. So it might be multifactorial or overdetermined, as they say, the causation of these things. But it's certainly worth thinking about what you raised. But you might not want to go back. You know, if I was young again, I wouldn't want to go back to when I was growing up, because you know, freedom is something to be cherished, but maybe it's got to be supported better than what we are doing at the moment, and valuing the young people. That's why I put out those negative quotes about the way people think about young people, because I don't think even if you just think about the economic things we were just talking about, we should just value young people, even in a self-interested sort of way from society, but we should just value them because, you know, I was chatting with Joe in the break about how incredibly, you know, dynamic and helpful it is to us to have young people involved working with us. You know, it's a massive energy source, and all the new ideas are coming from that generation. So, you know, to sort of not value and nurture that, it's very self-harming, I think.
Yes, Rob. Last question, I'm afraid.
Thanks, Joe, and thanks, Patrick, for a great talk. We can have lots of ideas and questions, but I'm going to try and pull it into two that are linked together. First one, is there evidence for involvement in activism? And you did mention that Gen Z seem to be getting more involved in activism. Is there evidence that reduces the incidence of mental illness? That's the first part. And the second is probably preempting the answer. What is being done to educate and involve our generation, the boomers, in building solidarity with Gen Z in that area of activism?
Yeah, look, those are great questions, which I probably can't really answer. I think there might be some research on that. I just don't know. I haven't seen it, but it'd be worth looking to see whether it's you might at face validity it makes sense, doesn't it? It certainly was a good thing, you know, in my generation to have that. I remember it very much. You know, I felt I was very lucky in some ways to grow up in the late 60s and early 70s. especially in the Whitlam government when that came in. It was very inspiring to be a young person. You felt incredible optimism for the future at that time, and I don't know if anyone shares that feeling, but I'm sure many of you do. Yeah. So my gut feeling is yes, for sure, but it'd be great to get some, probably is some research on that. Second question was, just remind me, sorry.
It was what's being done to educate and involve
Oh,
our
yeah.
generation in building that solidarity with Gen Z.
Yeah, well, I suppose around climate change, there's a lot of that happening, isn't there? So maybe around some of these other economic issues, like that's where we let them down, I think by not going with those economic reforms, and now it might be back on the table. If the government could be encouraged to be a bit brave again on those things. That Jim Chalmers, the way he talks about the economy in a much more holistic way is sort of encouraging, I think. And if we could sort of get somehow communicate that in a political sense, that would be good. We did set up a thing called Australians for Mental Health, which is like a get up for mental health, like an activist group. I tried to do that from 2010. I had 3 goes at it, trying to set it up. And it's very hard to fundraise for activism. The traditional philanthropic and corporate sources are not interested in that. They'd rather fund the children's hospital and stuff like that. More buildings, yeah. So, but it's started to get momentum now. We had 2 great CEOs. We've got a great board, including former CEOs of GetUp. So I think that. That's a transgenerational thing. There's old people and middle-aged people and young people involved in that, and that's something we could work on from a mental health point of view. But yeah, it would be great to build solidarity across the generations and put effort into that, because we're all grandparents or parents or sons, daughters, whatever. It's the human race we're talking about, isn't it? Here, so it's a great quick thing to end on. So thank you very much for the question.
Okay, well, I think we've had a very rich evening's consideration of critical issues which affect the mental health, not just of individuals or those around them, but of the society as a whole. Yes, thank you. And that is, of course, part of the conversation of the Crossroads agenda. We need to make conversation, I think this is our vision, an integral part of everyday life. Conversation around the issues that matter, however we define those issues that matter, and to find ways in which one does it as part of everyday life, not just in formal settings like perhaps this evening. So we need to somehow find ways of connecting the formal and the informal when it comes to conversation, small and large, online, in person, and other aspects of conversation. That's the critically important thing. And for those of you who may not be fully aware of it, we have 2 major priorities and have had them for some time, though they haven't been particularly well executed as yet. And that is conversation across generations, which is what we've just been focusing on, intergenerational conversations, and secondly, intercultural conversations. Those who come from different cultural background, different ways of seeing and understanding the world. And hopefully we will try and create settings in which this can be done more effectively than is so far the case. Intergenerational and intercultural conversations are not as well advanced as they ought to be in a place like Australia, and no doubt in some other parts of the world as well. So there is a lot to do. If you want to be on top of anything that's going with the conversation at the Crossroads, please consult the website, which we update from time to time, and keep a lookout for future activities and events. And we will, in any case, be in touch with you through various mail outs and so on. Those of you who are here because you were invited by someone else, if we do not have your name and address and would like to be kept in touch, would like to be placed on the mailing list, please make that happen. It's up to you. You give it to the person who invited you to come, and they will pass it on, and we will put you on the mailing list. It remains for me just to thank everyone, all those who helped to organize the evening, all of you who participated online or in person, all those who helped with registration, including Rita and Chris, and all the others who have helped to bring friends and guests with them this evening. And of course, I'd like to thank especially our speaker, our guest for this evening, Pat McGorry, who is a living treasure of Australia, and hopefully one that will flourish in the years to come. Continue to flourish.